This is Jeremy with Chiral Clarity, and in this video, we'll be going over the sacrum and the coccyx. Starting with the sacrum, we have what's known as the sacral base. The sacral base is the broad superior end of the sacrum that articulates with the fifth lumbar vertebra. Because we have a sacral base, we also have a sacral apex. The sacral apex is the inferior tip of the sacrum that articulates with the coccyx. The anterior aspect of the sacral base is what's known as the sacral promontory. And on either side of the sacral base, left and right, we have what are known as sacral ala. Ala stands for wing, and that's exactly what these bony landmarks look like on each side of the sacrum. Aside from that, we have these holes. Foramen stands for small aperture or opening, and that's exactly what these are. Anterior sacral foramina and posterior sacral foramina. The key difference is that the anterior sacral foramina transmit ventral rami of the sacral spinal nerves, and the posterior sacral foramina transmit dorsal rami of the sacral spinal nerves. And since we're on this posterior aspect, we can label the median sacral crest. This is the median sacral crest, and just as we have a median, we have lateral sacral crests on either side. These exist just lateral to the posterior sacral foramen, or the posterior sacral foramina. Looking at the sacral base, posterior to it, we have what's known as the sacral canal. It's filled in on this model, but it is usually hollow. And on the inferior end of the sacrum, we have sacral hiatus. Last thing to note on the sacrum is its superior articular processes and facets. Touching on the coccyx, on either side, we have its transverse processes. And a little bit medial to those, we have the coccygeal cornu. That concludes the sacrum and the coccyx.